October is celebrated as Breast Cancer Awareness Month globally. Today, we are going to talk about breast cancer. Now, we all know that the basic unit of life is a cell. Normally, cells are programmed such that they are, let me say, born, they grow, and then they die off. And then they are replaced with new cells. In the case of cancer, a new cell grows abnormally, and then it also multiplies abnormally. So there are no restrictions on the growth of that cell. So when that happens, then we say that the cells have become cancerous. Is it only women who develop breast cancer? The answer is no. Men can also have breast cancer, but then it's more common in women. There are some factors that predispose a person to having breast cancer. So we do not know the main cause. We know that an infected female Anopheles mosquito causes malaria. So in that case, it's easier to control malaria, isn't it? Now, in the case of cancer, we don't know what actually causes cancer. There are some factors that predispose a person to cancer. Some are modifiable, others are not. So first and foremost, for breast cancer, being a female is a great risk factor. And then age. As you grow older, you become more predisposed to cancer. Alcohol use and smoking are other factors. Sedentary lifestyle and then having a family history of cancer also predispose you. And then when you have had cancer in any part of your body before, or you have been treated for cancer for any part of your body before, you are also at risk of developing cancer in the breast. You have a better chance of survival if breast cancer is detected early enough. One of the ways of detecting breast cancer early is through self-breast examination. Self-breast examination is done usually a few days after menstruation. You do that a few days after menstruation because the breast goes through changes as part of premenstrual syndrome. So the breasts become tender, more sensitive, and then painful to touch. Then they also become slightly bigger and then heavier when you are going through menstruation. You stand in front of a mirror with your upper parts naked. Then you lift both hands. As you lift both hands, you look into the mirror and then you observe any changes. So you need to look out for dimpling, redness on the skin. Sometimes too, the nipple retracts. It pulls inward. Okay, so you need to look out for anything of that sort, or even a rash. I mean, you know your breast, you know what is normal to you. So anything you see on the skin of the breast which is not normal, you need to probe further. The dimpling is a sunken area. It looks like the dimples we have on our cheeks. So if you should see any sunken uneven area on your breast, you need to report that. If you should see any rash or redness or skin discoloration, any form of skin discoloration. I'm saying that because in blacks, you may not see redness. You may rather see something different, skin pigmentation darker than the shade of your skin color, or lighter. So any skin discoloration you see, you should report it. Now, after examining the skin of your breasts, you now go to the proper examination of the breast. So if you are starting with the right one, you put the palm of your right hand at the back of your head like this, and then you start palpating with the pads of your fingers. Okay, you can either go in a circular motion or you can go from top to bottom. So you start, so there's a portion of the breast which starts from the armpit. Okay, it's called the axillary tail of Spence. So you start, you palpate. If you feel any pain or any lump anywhere, you take note and then you can report. So I'm going in a circular motion. all right, like this, back to where I started from. Then when you are done, you squeeze your nipple a little to see if there's any abnormal discharge in it. Now, if you are breastfeeding, you are likely to see milk coming out, but if not, you're not supposed to have any discharge from the nipple. So if you see anything like that, you add it to the things you are going to report. Now, when you are done, you put your hand down, and then like you did for the first one, you do for the other one as well. You go, so we can do from top to bottom here, like this. Then you come top to bottom. Take note of any pain, any lumps, or whatever, anything that is not normal to the breast tissue, okay, like that. Then when you're done, you also squeeze the nipple a little bit. You don't squeeze it too much to cause pain, just a little bit to see whether there will be any discharge. If you don't see any discharge, if you don't see any if you do not feel any lump or any other thing, no pain, nothing like that, yay, you're good to go. One other tool for early detection of breast cancer is the use of mammogram. For that, you'll have to go to the hospital and then have it taken for you. In this month of breast cancer awareness, I'll urge everyone to visit the hospital for a routine breast examination. If you are diagnosed with breast cancer, there is still hope. As I said earlier, early detection helps in the treatment of breast cancer. So for those who have image problems after breast cancer treatment, there are options available. I'll encourage you to discuss these options with your healthcare provider. Don't wait till October to have your breast examined. You can always do a self-examination at home or walk into any health facility to have your breasts examined. Remember, early detection is key.